When you're suffering from muscle pain, the last thing you want is to be poked and prodded with needles. Or is it? The technique of dry needling can be super beneficial to relieving tightness and trigger points of your body. Horizon Health's Danielle Colvin joins me in this episode of Being Well with the ins and outs of dry needling.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming back a former guest to the show. We've got Horizon Health's Danielle Colvin with us today. Welcome back to Being Well.
Thank you. Thanks for having me.
Of course. We've swapped out hosts since you were here last, but just since I haven't got to officially meet you and maybe some newer viewers, can you introduce a little bit about yourself and how you ended up in the healthcare field?
Right. So yes, my name is Danielle. I've been a physical therapist for 14 years. I have been with Horizon Health for the last 7.5 years. Okay. The topic I'm talking about is dry needling. I've been doing that for 3.5 years. I was born and raised in Paris. I moved away for about 15 years. And then after my husband and I had our first child, Brinkley, she kind of brought us back to Paris. It was just more the right choice to move closer to both of our parents. And so that was about 7.5 years ago. And then we had our son 5, and that's where we are now.
Wonderful. And so you are back. You are definitely ingrained in the community. You told me that you're coaching basketball, which is super exciting.
New development.
And so I think that today's topic will actually kind of play into that really well. So you said we're talking about dry needling and highly utilized by athletes. Is that right?
Yeah. A lot of athletes are familiar with it, especially if they played in the collegiate level. Yeah. They had exposure, and it was very helpful to come back from acute injuries and get them back to the playing field. So
yeah, okay, so let's back up a little bit, because all week everyone in my office has kind of been bebopping back and forth. Oh, dry needling, is that like acupuncture? And I really want to kind of dial in. Are they the same, or what's the difference?
No, they're very different, other than the piece of equipment, which is a monofilament needle. Okay. So the needle is similar, of course. I'm not an acupuncturist. I would not speak upon all the details of it, but from what I know, it's more Eastern medicine based. Yeah. Dry needling is more Western medicine based. It was developed because of research studies that were being conducted to work on the effects of injectates. So a hypodermic needle was going into a tissue, they were injecting it, and having a control group that was just having the needle, no actual medicine or pharmacological agent. So they were finding that the control group that wasn't having the medicine was reaping the same results as those with the actual medicine, the corticosteroid, a lot of times lidocaine, saline, whatever the case may be. And then they were noticing that even long-term, they were having better results than the experimental group with the injectate. So it just morphed into more research and developed that, we can use a smaller needle, have less tissue damage. It's more comfortable for the patient, and it's leading to a lot of tissue health and healing. So in that way, it's different. acupuncture uses, trying to find the vital force of life and the balance of chi, and they use meridians. So it's a whole process. Again, I'm not educated on that side of things, but we use it in relationship to the spine and our spinal nerve roots. So we follow dermatome and myotome patterns within the body, and we just have certain target tissue. If you have a trigger point, sometimes we're targeting that trigger point. Sometimes we're just targeting a muscle group that needs attention to it. And I'll, of course, get into that a little bit more later. But that's where they're very different. We're actually going into the muscle belly, and we're going into the contractile tissue, and the acupuncture needle is a lot more superficial, and it's not doing that. So.
And yours is more of a, from what I understand, a quicker process, where acupuncture, you kind of sit with the needles.
Yeah, I think. Honestly, I've often thought I should get that done just so I can experience it. A lot of people have that question, and they want to know the differences, and I've never experienced acupuncture. So, of course, I have the dry needling, so it would be a good comparison to experience that. But I can't speak on that.
No worries at all.
But yes, it's a little quicker, I would say, if you have to lay there for a long time with the acupuncture needles in. So.
Yeah. So just in general, how common is dry needling?
Well, it's building up some, popularity, because in Illinois for years it was being performed, but it wasn't in our Practice Act. And then we got to the point where they kind of put a nix. It was kind of getting some pushback from other disciplines in the medical field. Okay. And so they kind of took it out of and they said, no, you cannot do that. And then in 2018, they put it back. We kind of pushed, and we got it back into our Practice Act. And so they put it into our umbrella within our scope of practice. And at that point, it's been picking it up, because now that it's in our Practice Act, we're covered liability-wise and everything, so it's safe for us to perform. So you're going to see a lot more of it now since 2018, now that Illinois has it in our Practice Act. And in that way, we have 3 physical therapists at our clinic that performs it. And I don't know, I think in the surrounding area, I don't know if Sarah Bush has somebody. I guess we'll have to
Just
see.
one of those research things. You got to kind of look into it.
They have to build into, someone, if they're interested in it, they might just have to call locally and call rehabilitation centers or physical therapy offices and see just someone offer dry needling.
Yeah, so. And you're like, hello, we need this. Look at all the benefits.
Yeah.
And so
it really is.
You're kind of hitting on it a little bit, but what kind of certification does your person who's performing dry needling need to have?
Well, it can be a physical therapist, doctors, physician assistants, chiropractors. You have to be licensed in your field of study, of course, first of all. And then second, then you have options. You usually have to practice clinically for a couple years before you can sit for a course. And then the course, there's different levels. Level 1 is a 36-hour credit type of course where you go for a full weekend, 3 days actually, and you just learn it. And then you have to do that for a year before you can go sit for level 2. This is the course I chose to do. It's a very popular one within the nation. And then you can do level 2. It's not a certification, but you do have to take a competency written and lab exam for it to show. But of course, the key is you've already done all your curriculum to learn the anatomy and have all the background knowledge of the human body in your schools of physical therapy, chiropractic work, or medicine. And then you can build on it by adding this layer.
And did you say there's a third level?
There's a third level.
Which is more intense, I guess?
It's just deeper. It's specialized in like the pelvic floor and stuff, where there's a little bit more, there's just some complexities there. So they want to make sure that you're really proficient with your needle work and you're comfortable.
It's a sensitive area.
It is.
That's understandable.
So,
but it's good to hear that, you all are going through extensive training, because I think it's a little intimidating to get needles, in your body. And I don't want someone just doing it willy-nilly.
Yeah,
so
no. And
it's comforting.
Yeah, there are very few of, I can't imagine any clinician just doing it willy-nilly, but yeah.
Okay, so insurance. Does insurance kind of cover this, or?
It doesn't in Illinois, not yet. You know, just like anything that's added into our Practice Act, and it's going to take some time. They want pretty extensive research being performed to show its efficacy and safety within the population, and then they usually want more and more until it finally gets approved and covered by insurance. So right now, no, we don't bill for the actual dry needling, but we do bill for all the time that we do with the manual assessment of the body and the tissue and the response to the needling following the actual session. And we always do needling with some other therapeutic tool like exercise, manipulation, soft tissue mobilization, taping. So there's always other things that are coupling with the dry needling. It's not just that and only that. So.
And how do I get connected with you all? Is this something I get a referral for, or do I just walk in?
Yeah, you just with anything in the physical therapy world, you would want a referral from your primary care physician or your specialist, because it is always going to start with a initial evaluation where we're looking at all of the objective, subjective information. And then at that point, we come up with whatever pathology we think is the problem, whatever dysfunction that we need to work on to get you back to your highest level of functional independence, and then get your pain under control, which is usually why people are coming into us, is they have pain or loss of function. Then at that point, we determine, yes, we do think dry needling would be an asset to you, and then we discuss that with you. We talk about what that's going to look like. You know, I think dry needling would be good for you because of X, Y, and Z, and then we get consent and work through all that other stuff.
Yeah.
So.
Well, and let's back up a little bit. So what could be a potential reason that someone is coming to see you for dry needling?
Right. So
or reasons.
Yeah. So there are a bunch. I am an orthopedic specialist in the world of physical therapy. So I primarily deal with any orthopedic problem that's neuromusculoskeletal disorders. So in that way, we will do the initial evaluation. We will look to see what's involved, and it's typically when I'm thinking this person could benefit from dry needling is when they have a overuse situation. A muscle is being too hyperactive. The nerve is too highly communicating to that muscle group, where there's a situation where some muscles aren't doing their job. These muscles are doing too much. It's leading to inflammation. It's leading to pain. Then if I can find that source, if I can find that tissue, get that needle in there, then we can calm it down. And what I mean by that is we reset it to its natural anatomical form. So at rest, your muscle tissues should really be soft and pliable and relaxing.
Yeah.
When they're overused or they're hyperactive, they're kind of always in this tense position, which is not good for them. It doesn't allow the healing process to take place. So if we can put that needle in there, we can get that reset to happen, then that muscle can soften. And that's a lot of times what they'll tell me. Like after we do the needling session, they'll be like, oh, it just feels so much more relaxed. It feels soft. I can move my head without this like sharp like pain within whatever muscle we're doing. And then that's when I know it's been a successful treatment. But that's typically. However, it can also be used to enhance muscle performance. Sometimes, we'll have muscles that aren't able to contract well, and we need to go in and stimulate them. We need to go wake them up a little bit. So it can be utilized for that too. Sometimes it's for nerves. Nerves are not communicating, or again, hypercommunicating that information to the brain, and the brain is telling them, oh, keep protecting that joint, keep protecting. Well, that's not really, like, kind of snowballs into something bad, At first, your body has this amazing ability to compensate so that you can stay functioning. But that can turn into other problems, because you're just not getting a good balance within that space for you. So we gotta get things working in synergy again. So
yeah. Well, and you keep saying muscles. Do you mind giving some examples, like where can you have this done? Maybe where can't you have this done, or is there anywhere that's off limits?
Not really. Okay. I mean, again, I'm not level 3, so I'm not going to do your pelvic floor, but I'm okay with that. So you can do anything from...
What's common?
I do spine. So I'll do cervical, lumbar. I'll do the suboccipitals up here. A lot of people have cervicogenic headaches, and so I'll hit those suboccipitals. I've done it for TMJ, where you kind of go in and you hit some of the facial muscles there. We'll get those deep multifidi muscles that lie really close to the lamina and the transverse processes of the spine, which means you can't get to them by poking. I can't do soft tissue stuff externally to get to those muscles. I need to use something like a needle to get down deep there. Yeah. And I'll do that in the lumbar spine, the thoracic spine. I'll do a lot of feet. We have a wonderful podiatrist that is a firm believer in our dry needling, and she sends a lot of referrals, and we've seen a lot of success with feet, anything from plantar fasciitis to heel spurs and just like heel pain. Yeah. Not that we're breaking up the heel spurs, that's not what's going to happen, but we can soften the tissue around it and create less inflammation in that area, which of course correlates with less pain. And then Achilles tendonitis. But I'll do a fair share of like gluteal, like hip and glute needling for people with piriformis syndrome, sciatica, shoulder stuff. So
knee stuff?
Yeah, knee a little bit. Knees are a little, I don't do as many knees. Okay. Just because most knee pain is joint pain, and I'm not gonna needle, I need to target the contractile tissue. Now, if I think that there's a component like, you know, your quads, I got to get that calmed down. Or if I think it's like an adductor or tensor fasciae lata, so your IT band syndrome. So it's like lateral knee pain, and I need to target the hip to soften those up and, you know, calm down these, strengthen the glutes. Then I'll use it. But typically it's more spine and feet. This is what I'm going to see, or what I use it, or my brain goes to a lot when I'm assessing, like, you need some dry needling. Upper traps are a big one too. So,
well, you're kind of a detective. You're uncovering what you think might help maybe somewhere else in the body too sometimes.
Yeah,
which is all connected.
All physical therapists, whether they dry needle or not, we're always putting pieces together, trying to figure out, okay, that's happening and that's happening, and this is your mechanism of injury, and this is what I think is going on, and this is how we're going to fix it. So it's just, I've got this extra tool in my toolbox that I can use to address some of those pains.
Okay. Well, okay, so as we're talking about this, is there any part of the actual process, you've kind of talked about it a little bit, the sciencey part, what you're actually doing. Do you want to talk about that a little bit more? Yeah,
so when we are inserting that needle, we're trying to disrupt the tissue in a way. Like, I want to put the needle in the trigger point, because that trigger point is a ball of tight muscle fibers and nerve endings that are very hypersensitive, and I want to break that up. So I'm going to go there. I'm going to try to find that, and then you can either piston, and sometimes they'll use electrical stimulation, which requires just a small electrical stimulation unit, like a TENS unit, and then they have alligator clips that they put on the needle, and then that sends an electrical current into the needle directly into the muscle, and then that resets those nerve endings. It, again, gets that reset started within the muscle fiber. And that's when sometimes the session could take like 10 to 20 minutes, because it's all patient-based. Are you feeling that release? Do you feel like the thumping has gotten less? Those kind of things are what they're telling me. And then, you know, when we take it out, then it's nice and, oh yeah, it feels really a lot better. I use the upper trap as a example just because it's kind of easy and
also prominent.
Yeah, most of us have a lot of trigger points in our upper trap that lead to neck pain and dysfunction. So so it works on the muscle performance I mentioned before. It works on the calming down of muscles. It works on stimulating nerves a little bit. It can work on the healing process of tendons, some too. but it helps kind of pull in more blood flow. When you disturb a tissue, you're encouraging blood flow into the area, which brings oxygen, and the oxygen saturation is what promotes healing in any tissue in our body. We want to get blood flow to the area. So that's, in a nutshell, what the actual physiology of the needle is doing in there.
Is there another option besides the pistoning?
Well, is the electrical stimulation. So in that way, you would find that target tissue, put the needle into it, and then you would use the electrical stimulation that acts as that input instead of the needle going in and out, which the pistoning is that needle going in and out of the tissue at a certain amplitude, and then that creates the change or a twitch in the muscle. That twitch is again that response that's what we want you to feel. That's a good thing. And it just feels like a quick contraction of the muscle, and then sometimes it's startling, but it doesn't really hurt. Patients are more like, oh, okay, yeah. I didn't mean to do that. I'm like, yeah, no, your muscle is just going to do that because it's
been so stressed.
Yeah, it needs this.
The pistoning, I'm sorry if I misunderstood. Are you doing that part by hand then?
Yes.
Okay.
That's just by hand. Yeah, you find the depth, and then you just go in and out, and you piston it in there. That's a little more uncomfortable than the electrical stimulation. So most people and therapists are going to choose to do the e-stim with the needling.
And let's talk about that, because as somebody who maybe has a phobia of needles or getting their blood drawn, it's intimidating. It sounds intimidating, at least.
Yeah.
Expected pain level potentially.
People are always shocked at how little the pain. They always anticipate and hype themselves up to thinking that it's going to be more painful than it is. The only caveat to that is the foot. The foot is not comfortable. I'm not going to lie. But most people are coming in with so much pain that I'll do anything. I need this. Yeah, I'm going to try anything right now. If you think it might work, then let's go for it. So they're willing to. Now, anywhere else in the body, for the most part, it might feel a little crampy, some deep pressure when it gets into the muscle. The initial tap, usually some people are like, oh, did you do it? Oh yeah, I did it. And then now you're going to feel some deep cramping, maybe some pressure when I get to the muscle. But once it gets into the muscle, it's fine. You know, you don't want to move that muscle. You don't want to contract it once the needle's in there. But as long as you stay rested, they don't feel anything. So sometimes when the initial poke, you are going to feel it if it's a really hypersensitive area. Sometimes when people are having really strong acute low back pain, even just that initial poke on the surface, it's uncomfortable, but then as it's going in, they're usually okay. So, I mean, you're hitting an area that is already very painful. So, but people, I always get their consent. I let them know what to expect. And by the time they get off the table, they're usually like, oh, that feels so much better. I'm so happy I did this. The relief is
so worth it.
Yeah, exactly. Sometimes you have to go through a little more pain to feel less pain, right? It's one of those things, like, it's okay. You're going to feel a little sore, and then it's going to feel better. And you got to look at the long haul.
The big picture. So in our last couple of minutes here, what should I expect if I'm someone who's going in for my first dry needling appointment? Is there anything special I need to do beforehand?
No, not really. I mean, we'll do the initial evaluation again. Like I said, we'll do it, all of that subjective, all that objective information will be assessed, and then we will we'll determine if it's going to be. Then I'll ask you, do you want to, this is what I think would work, and this is why. Do you want to try that? And do you want to try it today? Or do you want to try it next session? And depending on the person, they'll tell me what they want to do. And then we'll go in to it. And I always position them in a very relaxed, comfortable way so that they can hang out there for potentially 10 to 20 minutes. And of course, I'll have to have that target tissue accessible. So if I'm doing your spine, I need you on your stomach. And we have comfortable beds that allow for that. Then once you get done with that, you can come off the table. I'll show you some exercises, show you things that I need you to start doing at home. And then that'll be that until the next time I see you. Usually we only dry needle once a week.
Okay.
So that doesn't mean you only come to therapy once a week, but we'll do needling once a week, and then we'll do other therapies and exercises and soft tissue stuff the other day. So
I have
That's
a
what
few
they
other
should
quick
have.
questions.
Sure.
Do you bleed? Does it make you bleed?
No,
Okay.
you shouldn't. Now, some some of those superficial capillary beds, you might get insulted, but we stay away from those big arteries. That is not our target tissue.
Cool.
We're not trying to get any of those blood vessels. So, and if they do, if I'm like, oh, we got a little capillary, and so you might have a little bruising there because of it. But otherwise, yeah, it's pretty much. It's good. After the needle comes out, you don't have any bleeding. There shouldn't be any bruising. There might be some muscle soreness there that correlates with the site, just because you're breaking up some of that tightness and things in there. So it's just kind of like anything else with massage. You're supposed to drink a lot of water. You're supposed to gently stretch those muscles, those kind of things, to make sure that you can kind of promote the best healing possible.
And then you're talking about not being able to hit everything at the surface level. So how deep are these needles going potentially?
Depends on what muscle.
Okay.
So
You're
there's
talking like
different
from here to here?
Yeah, there's some like the shortest ones that we have are here, and then the longest are
One more time?
They're long. But that's trying to get those deep, like, booty muscles. Those are getting those deep glutes, and those are deep. You know, you've got you think about where your pelvis is and all those muscles that lie right against it, and then you've got all those other structures that are in the way to get to that muscle. So, I mean, again, we have to be able to get to what we need to get to. So some of those do have to be a little longer, otherwise they're not gonna get to the depth we need to get them to. I don't show patients those ones because it freaks them out, and you don't feel it as it goes through layers of skin and fat and all that stuff. You're not feeling that. Those don't have nerve endings, so you're not going to feel anything like that until you get to the muscle, and then you'll feel that deep cramp maybe a little bit, but then it subsides pretty quick. So, I know it's a good question though, but usually they don't want to see, and I'm not going to go in their face and be like, look at what I'm about ready to poke in your booty here.
A final real quick one, and I'm sure it is variable as well, but as far as how many needles?
Usually only 2 to 4.
Okay.
Yeah. We don't go ahead. We know where we're trying to get to. Yeah. We go there, and you have to put 2 in usually because you have to have a ground for, but sometimes we'll just do 1 at a time. We have a handheld, or we'll do the piston, or we'll do a handheld where you only have to have 1 needle in at a time. If I have someone that's really, really skittish and I only have 1 trigger point that I'm really concerned about, then let's just try 1 and see how that goes. And then they'll tell me like, yep, that's enough for today, or something like, yeah, that wasn't so bad. Let's try it again. Let's try another one. So we can do 1 at a time too, but max is 4 the first time that I'm gonna see someone, and maybe even all the time, but
I think you see the picture of the
possible.
people getting acupuncture, and that was what I had to ask about, because it's just like they are covered in needles, and that just seemed intimidating.
Yeah,
so again,
it's different.
A lot of differences between the two.
A lot of differences. Yep.
Well, Danielle, thank you so much for coming on today. I learned so much.
Well, good. I'm glad, and thank you for having me. We always appreciate coming and teaching you about different service lines that we offer at Horizon Health.
Of course, the pleasure is ours, and we hope our viewers will join us for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.